or who right.
Good afternoon, everyone. I am Allison Kelly. I just wanted to introduce myself to you. It is nearly 12 o'clock. We're going to get started here in about 1 minute. Just a reminder for everyone to make sure that you're on mute, and that way everybody can hear. I do hear a little bit of background from some of the attendees, so if you could just check your settings really quick and make sure that if you're joining by phone or by computer that you have that mute option set on your phone or your computer, please.
I don't want to be on it. I just want the volume. I just went off. I was on screen and now I'm off.
Yeah, I don't know the whole thing. And I just think
All right, once again, I can hear people on the line. So just so that everybody is able to hear the presentation, if you could please make sure that your phones are on mute and that your device is on mute as well. All right, thank you very much. That's very helpful. Okay, it is 12 p.m. Hello, it's good to see everybody here. We've got a nice group on the phone today and on the line. Looks like we've got 41 different participants today. So welcome, we're really glad that everybody is here. My name is Allison Kelly. I am the grant manager here at the North Carolina Association of Free and Charitable Clinics. I will be your primary point of contact for this NC Pro grant. And just a few housekeeping things kind of to get started. One, again, keep your device on mute, and that way everyone can hear. The other thing is, this is an opportunity, in addition to learning more about the grant, it's also an opportunity to get your questions answered. However, because we have so many participants on the line, it would be really helpful if everyone could please focus on the chat for your questions. Mark is actually here, and he's going to be our facilitator today to make sure that all questions are answered. And that those are brought to me at the end of the presentation. So he's going to be reading some of those out. But as we go along,
yeah, I mean, she's not muted.
Uh-huh.
That means muted.
Yeah, and Cindy looks like she hears what's going on, doesn't she?
we do. We can hear you guys. If you can put your phone on mute, if you'll hover over the bottom of the screen.
Wait a minute. Oh, no, that's for me. I can hear Allison.
Yep.
Please check that your speakers are on. Well, they were on. Is it our internet connection?
So we need everyone, please, to either mute or try to stay quiet for now so everybody can hear. Thank you. Okay. So my goal today is to share the information that each of you need in order to make a decision about opting in or opting out of the grant. We are really hopeful that as many people can opt in as possible. We recognize some clinics may choose not to, and that's certainly fine. We have received a bunch of questions via email and also through conversation leading up to today. So I want to thank everybody for that. Those have been incredibly helpful. I'm going to do my best to integrate the answers to those questions within this presentation. However, if your question is not answered, make sure that you, let us know through the chat, and we'll make sure to try to get to that at the end. Now, it may be that we don't have enough time to get to all the questions, and if that's the case, I just want to assure you that we will have a frequently asked questions document that'll be posted to the members portal. If you don't have access to the members portal, Mark can help you with that. So make sure to reach out to Mark so you can get that. This PowerPoint presentation is already posted to the members portal, and we've also posted a list of credentialed clinical staff. We'll get to that in a minute, but that's also posted to the member portal right now as we speak. So thanks to Mark for doing that. All right, so there may be some situations that are specific to your clinic, and we may not be able to address those today in the broader audience. So if those kind of questions come up, I'd love to be able to have a conversation with you, or even perhaps an email exchange about those situations. So let's maybe take those offline today if those happen to come up. All right, so having said that, one quick reminder is that we do need an opt-in or an opt-out, and we'll talk a little bit more about what that means by this Friday, the 17th. So we recognize those timelines are pretty time sensitive. It's a little bit tight, but all of that is so that we can follow up with the Office of State Budget and Management promptly, and we have some timeline requirements related to that. So having said that, we're going to go ahead and dive right in here. One thing I want to just acknowledge right off the bat is this is really a pretty historic appropriation for the association and its membership. And so I just want to express my deep appreciation for the opportunity to be involved in this with each of you, and also, you know, for all of our membership that have posed excellent questions, have really posed some thought-provoking, you know, questions and situations that have allowed us to gather more information on your behalf. Also to the North Carolina Association of Free and Charitable Clinics Board, who has been very helpful as well. And I'm certainly the staff at NCAFCC. So everyone has really pitched in and made this historic opportunity a reality. So with that, we are going to dive in. And again, one more quick reminder to ensure that your phone is on mute, or at least that you're in a quiet environment so that everyone can hear. Okay, thank you. We're going to go right ahead here. All right, in the essence of time, I think probably most of you have seen this language in your agreement and in other places within the grant documentation. I'm not going to go into too much detail here other than to say, as an association, we have been allocated, you know, $7.425 million to distribute to you all as members. This is for specifically for eligible health services during the COVID-19 emergency. So we're going to talk a lot about what that actually means as we go on, but do recognize that these funds are federal funds, and therefore they do have federal restrictions. And so a lot of conversation has already been had around that, but we're going to go into some more details today. All right, I believe we already covered that. Just some background here. I'm not going to go into too much detail other than to say that the grant is based upon two laws, and also state laws, 2024 and 2020-80, and also the CARES Act. So we do have to act in compliance with these particular laws as we utilize this funding. All right, so you'll notice that according to the CARES Act, all expenses that are incurred due to the public health emergency related to COVID-19 are applicable for this particular fund. They do need to be, those expenses need to be incurred between March 1st of 2020 through December 30th of 2020. I do want to point out that December 30th, given that that's not the last day of the year, but that is when this particular grant ends. So all expenses need to be during that time period. The grant, as you will come to learn, is fairly restrictive. We're going to go into some details about that, but know that the use of the funds is actually subject to audit. So we want to keep you guys safe in that regard, and that's why many of the recommendations and guidances that you're going to hear today are structured to just, you know, allow that to happen so that, you know, the funding is used appropriately. State guidance, again, you've probably seen this language. I'm not going to go into too much detail here. What I do want to tell you is when we get to Friday, so when we talk about opting in or opting out, what we really want to encourage clinics to do is to opt in if you have an opportunity to use at least half, if not a majority, of the funds that are allocated to your clinic. So we recognize that there may be situations where you're not able to use the full allocation, and I just want everybody to know that that's okay. So if that occurs, we do have the opportunity to redistribute funds that are not utilized at any one clinic to another clinic that may have a need. I know that's not an ideal situation for a lot of clinics, and certainly if you are able to expend the funds fully, we would love for you to, but don't feel like you have to, because there is the opportunity to redistribute that across our membership. Okay, so I mentioned earlier about ensuring that we're keeping you guys safe and compliant. The reason is if for any reason the funds are found to be disallowed by federal law, then actually those funds have to be returned. We don't want to put anybody in a position where that's going to happen. We know you don't want to be in that position for something to happen, and that's why the recommendations that we're going to give you today are so important. And then just know that any interest that's earned on this fund also has to be used per the agreement, so keep that in mind. They're pretty clear in the guidances that this particular funding cannot be used for revenue replacement or for donated services. So one other thing to kind of keep in mind. And then, you know, any unused funds. Our goal is to not have any unused funds, but if we do have unused funds, they do have to be returned to the Office of State Budget and Management next year by by January 30th. All right, so we've had a lot of email exchanges about this particular information. I'm going to go into some more detail here and give you some examples of what we understand to be duplication of benefits. So know that for this grant, duplication of benefits is not allowed whatsoever. And so you'll see a listing here of different things that could potentially represent duplication of benefits. And so in addition to things like Medicare, Medicaid, or other third-party payments, PPP loans play into this. I've talked to several clinics that have gotten PPP loans. Patient payments, so if your clinic has situations where patients pay a certain fee for a visit, those would need to be backed out of any kind of reimbursement that's, you know, applied to this particular grant. Community health grants and other funding that may be part of the Coronavirus Relief Fund. So just to go into a few details here, and these are to address some of the questions that have come in too. If your organization has received PPP funding or you know, have community health grants, it does not disqualify you from participating in this grant. So you can certainly opt into the grant if you have those other funding sources. What we want to be careful of though is making sure that nothing applied to this grant is covered by another funding source. So for instance, if you have, say, a community health grant and maybe, you know, 75% of your staff expenses are applied to that particular grant, you could theoretically apply the remaining 25% to this grant as long as it's not covered by any other funding source, and that would be appropriate. Another example might be if you received PPP loans for maybe the months of April and May, you could apply you could apply expenses to this grant maybe from March, and then again starting in June and beyond. So you could just skip those months essentially, that if PPP covered, for instance, all of your staff expenses during those 2 months, you would just skip those 2 months, and then you could apply the other months towards this grant. Again, I mentioned about patient payments. Those would need to be backed out of any expenses that you apply to this grant. Also, if you're getting Medicare and Medicaid reimbursement or any other third-party reimbursement, that needs to be backed out as well. So if you have questions about that, I'm happy to go through that on a case-by-case basis. I recognize not all clinics accept, you know, Medicare or Medicaid, or even third-party, you know, payments. But if you do have questions about that, we can certainly talk about that offline. The other thing I want to mention is this also applies to any other grants that might cover COVID-19 related expenses. So there's some grants that have provided some telehealth equipment, for instance, and those same expenses could not be applied to this grant because, again, it would be considered duplication of benefits. Okay. All right, so to be eligible for reimbursement under this fund, we've got our timelines we've already talked about. It can't be reimbursed by any other program. It has to be demonstrated to be an eligible expenditure, and it also needs to be backed up by documentation. So those are the 4 kind of key points in terms of reporting and applying expenses to this grant. The other thing to know about the grant is that when you apply expenses to the grant, we're going to look at this on a reimbursement model. So essentially, when you do your first monthly reporting, we will issue your payment after that monthly reporting has been processed. So your first payment should come somewhere in the neighborhood of mid-August. So just a heads up about that. All right, So you'll notice this on your agreement, your grant agreement that you've received. These are the different categories of expenses. I do want to point out one thing that's really important, and I think that I've probably hammered this home by now, but all expenses have to be tied to COVID-19. In some way or another, they have to be tied to COVID-19. So keep that in mind with each of these categories. All right, in terms of our recommendations, so we had a lot of conversation as we were planning for how to roll this grant out to members. And much of that conversation was around how do we do this in a way that allows our members to be compliant, number one, first and foremost, but also to minimize the amount of reporting that's required for you. We really wanted to be able to streamline how reporting was done and how much reporting was required, because we recognize that there's, you know, we don't always have the resources that we need, and we may not always have the time that we need to do some of these things. So we've really tried to structure this in a way that allows you all to, you know, streamline the process of reporting for this grant. So with that said, we're really asking that you try as much as possible to prioritize employee expenses. And I'll explain a little bit why that designation is important. But the employee expenses, what you will find is for many of those expenses, reporting is much more straightforward. And so we're going to talk about reporting today, but just know that for employee expenses in particular, it's much more streamlined. Okay. Oh, I'm going to go back actually a slide. Sorry about that. There's a couple other things I wanted to mention here. When each of your clinics received your attachment A2, which was the budget, you will notice that your full allocation was put into the staff expenses category for you. If you choose, after we have this discussion today, if you choose to move that into a different category, just know that you'll need to do that when you submit your budget. So for instance, if you have expenses that wouldn't fall under employee expenses, but maybe you have contractors that provide services for you, maybe a contract physician or something like that, you would need to move that expense into the contracted labor expense category before you submit your budget. So keep that in mind. If you choose to, for instance, utilize the equipment category, then you'll need to move that portion of that budget over into equipment. So think through that, you know, before you submit your A2, attachment A2 budget, because, you know, we recognize you may not be able to anticipate all expenses, but as much as you can, try to anticipate those categories. Okay. All right. So the reason that we are really recommending, you know, focusing on your staff expenses are because based on the U.S. Treasury frequently asked questions, and also based on the pathway that was paved for us through Governor Cooper's executive order, which I included in your original email about the grant, that executive order number 143, that has all led to free and charitable clinic staff being considered public health employees. And so when we talk about public health employees related to the CARES Act, they actually are considered substantially dedicated to mitigating or responding to COVID-19, and therefore the fund can be used to meet 100% of the payroll expenses for those employees. Now they do designate, because it's public health employees, they do designate kind of that healthcare stipulation. And so that's why when you've seen information about this grant, we've really focused heavily on this idea of credentialed clinical staff. And we're going to define that and talk about that more today. But that's really where we see that the payroll expense that's applied to this grant is that falls into that category, I guess is what I'm trying to say. Sorry about that. That the clinical staff are really the ones that are considered the public health and the healthcare employees, and therefore they are considered substantially dedicated. So again, you know, knowing that there's the risk of having to return money if it's a disallowed expense, we really want to take the most conservative approach possible, and therefore we're really recommending to, first and foremost at least, focus on those credentialed clinical staff at your organization. So these are people that are qualified by their education and training, their credential, they either have a licensure or registration, and they have a specific scope of practice for their professional services. So we have just posted, Mark just posted a document that has all of this listed on our members portal. But these are the different roles that fall into this credentialed clinical staff. And we're using this guidance from FQHC organizations to define this. And so what you can see is it's fairly broad in terms of the types of staff at your clinic that would be considered substantially dedicated, and therefore 100% of their payroll and any of their benefits would apply and could be expensed to this particular grant. So you can definitely reference all of that on the members portal. And I'm going to move to the next slide because there's some other, you'll see here, pharmacy staff, and also in addition to medical on the previous slide, you'll see here we've got pharmacy staff, behavioral health staff, and also dental staff. So keep that in mind. These are the people that can be, their payroll can be expensed 100% to the grant. And, well, let me go back actually. And the reporting for these folks is way easier. Really all we need from a backup documentation standpoint when you report this expense and apply it to the grant is we just need your payroll records because they're already defined as substantially dedicated. Okay, so moving on here, we've had a lot of questions and we've actually gotten some really recent information from OSBM actually about non-clinical staff. Before I move on, there's a couple points I want to make here. So when we talk about staff expenses, we're talking about existing staff or even new staff. So if your organization feels like you need to bring on new staff, even if it's temporary staff, then that's certainly allowed through this particular grant. But just know that right now that the end of the grant is December 30th, and we have no reason to believe that that's going to change. So that in terms of sustainability, that could be a challenge, but definitely something to be aware of. Okay, so when we talk about other clinic staff, and this would be administrative staff or even non-clinical support staff, I want you to know that OSBM has specifically said that these employees' payroll is presumed to not be substantially dedicated. And this is important because what it means for us is that if we choose to expense an employee's time that's not one of those credentialed clinical folks at our clinic, then we're going to have to actually provide more documentation to show that they are specifically engaged in COVID-19 related activities. You can use the funds from this grant to, for payroll costs related to those personnel. But again, we have to be very specific about that. So it may be that you can apply a portion of their staff expenses to the grant, depending on to what extent they're engaged in COVID-19 related activities. So for these employees, if you're expensing their staff expenses to the grant, you're going to need to, in addition to payroll expenses, you're also going to need to submit timekeeping records to specifically show the number of hours or the % of time that they're engaged in COVID-19 activities. And if they have specifically said that if you hire new administrative staff to manage COVID-19 work, then you could certainly apply 100% of their payroll cost for those employees to the grant. Now, this is new information from OSBM. So I want to make this clear because I've had conversations with clinics leading up to yesterday that maybe frame this a little bit differently. And so I want you to know that that has changed. And so it now is that, we can expense even a minority portion of their pay to this grant. So if you have, for instance, someone who is 20% dedicated to COVID-19 activities, you can apply 20% of their payroll and benefits to the grant. If it's more than that, you could do that. They don't have to be, considered substantially dedicated per se, but you do have to back it up and show that their work was dedicated to those activities. So a couple examples might be some that I've heard from clinics over the last few days would be maybe a medical receptionist, and maybe the medical receptionist is responsible for they're kind of the front lines of the clinic. They're responsible for asking screening questions to make sure that folks coming into the clinic are not exhibiting symptoms. Maybe they're taking temperatures and making sure that people don't have temperatures coming into the clinic. Or that if they do, they're responsible for separating them from the rest of the patient population at your clinic. Maybe, in that case, that employee, you could designate that time as spent on COVID-19 related activities. It might not be 100% of their time, but it could be a significant portion of their time. So in that case, we would need a timekeeping record to show the number of hours or the percent of time that was dedicated to those activities. Another example that I've heard from clinics recently is interpretation staff. So clinics have, interpreters, that are working with the providers, and they, are engaged in all of those clinic visits with providers. So that amount of time could be applied to this grant. But again, we need those, not only the payroll records, but also the timekeeping records for those employees. So keep in mind, if those situations come up, it doesn't necessarily mean that 100% of that person's payroll would be applied to the grant. It's only the percentage that's dedicated to those COVID-19 activities. Okay. So moving on.
Shift it right on up here, baby.
So it sounds like we've got some people off mute. If you guys could please put yourselves on mute, that would be great. All right, so in talking about employee expenses a little bit further, one recommendation is to focus on the role that the person has, not necessarily their credentials in and of themselves. So as an example, maybe your executive director is an RN, but really their entire role is administrative. So in that case, if 100% of their time is dedicated to administrative functions, their payroll and benefits would not be eligible for this fund. But maybe they have some clinical responsibilities. And if they do have clinical responsibilities, then that portion of their time could be applied to the grant. But again, those timekeeping records would be absolutely essential. And then I think we covered the examples at the bottom of the slide earlier, just some examples about how PPP loans and community health grants could play into this. So it may not be a full portion of payment or of your staff's expenses. It could be a percentage of it, essentially. So again, I think I've already covered this, but basically when we get to the reporting time period, and you're requesting reimbursement from your allocation, the things that we need, in addition to the reports that we're going to talk about in just a little bit, for employee expenses, we need those payroll records, and we need, if your benefits are in separate documentation, we're going to need that too. And then we need those timekeeping records, particularly for those folks that are not the credentialed clinical staff that we've talked about. And then all of that documentation will be submitted along with your attachment C1, which is your monthly report, and C2, which is your reimbursement request, and then we will process your reimbursement following that. All right, so I mentioned earlier that a couple clinics have mentioned that they do have some providers or other staff that are contract staff, and so certainly those payroll expenses, if they are eligible payroll expenses, and you're demonstrated as eligible, then those could be applied to the grant as well, temporary workers. In addition to that, some of the clinics have reported that they have had, an exposure, a COVID-19 exposure, and they've had had to undertake a massive cleaning effort at their clinic. And so they've paid a lot of money for that. If that's something that has happened, then certainly you could expense that to this grant as well, the cost of cleaning or disinfection. Many clinics have had to do some upfitting of their clinics for physical distancing or infection control, and any of those renovations, the labor associated with that is certainly applicable to this grant. And then anything to help kind of meet those infection control standards. could be applied under contracted labor expenses as well. So again, required documentation. If it's a construction kind of expense or something like that, we would need, or even the cleaning example, we would need invoices for the work that was completed. And then if it's a contract employee, we would need those payroll records and timekeeping if applicable. So those would apply just like we talked about in the employee expenses, and all of that submitted monthly to us in order to receive that reimbursement. All right, there is a category in your contract that talks about other service expenses, and it lists things like, phone lines and data and, leases and things like that. We really do not expect that to be used in this grant. If you need to discuss something related to that, please discuss that with me before you either budget for it or submit a reimbursement for it. It's really difficult to connect these things directly to COVID-19. And so there may be other situations that we've not thought of yet. And if those come up, make sure you talk to me about it. But we really don't anticipate that category to be used. Your agreement does indicate the requirements if subcontracting occurs, but we don't expect that to occur during this time period. So again, if that comes up, that's something that you need to discuss with me before you budget for it, please. All right, goods expenses. So the areas that we have identified through all of the information provided to us would be anything for COVID-19 testing supplies, any kind of sanitizing supplies, anything for cleaning, disinfection, any of those supplies would be applicable. And then certainly personal protective equipment as well. There may be other things though that fall under the goods category. I want to discuss those with you. And so if anything comes up and you have questions about it, let's have a conversation about that, because again, at the end of the day, we are required to use, the fund for eligible health expenses that are directly tied to COVID-19. So we want to make sure that we can meet that requirement. And again, invoices would be required for that, and you would submit that for your monthly reporting. All right, we have had some conversations with clinics about equipment expenses. What I want to point out is that this isn't just a general purchase of equipment or even database supplies or things like that, because again, it has to be tied directly to COVID-19. So the recommendation or the guidance that's been handed to us is really related to telemedicine capabilities and enabling telemedicine capabilities because of COVID-19. Certainly if you need to purchase laboratory equipment for COVID-19 testing or something like that, that would certainly fall into the equipment expenses category as well. But I did want to point that out because there have been several conversations about other types of technology equipment, and the connection to COVID-19 may not be there. And so I just want to kind of caution everyone on that. It really needs to be because, in order to enable telemedicine capabilities, and that has to be pretty clear in the documentation. So keep that in mind. I think, again, when you submit that or budget for that, let's have a conversation if we've not already to make sure that we can keep you compliant with that. And then the other expenses category, it's kind of the catch-all. If there's something that wasn't applied anywhere else, again, we want to have an idea for each clinic as to how you're going to be budgeting your expenses. And so just let's have a conversation about that before you submit your A2 form, and also before you submit any invoices if you're thinking that there's something that might go into this category, because we really don't expect it to be utilized. Okay, so we are moving on here to reporting requirements. So we are going to have monthly reporting. I'm going to give a little bit of a caveat to that, because your first reporting period, which is going to be the first reporting that's due, is going to be in August. It's going to be on August 10th. And that's actually going to cover 5 months of the grant. So it's going to cover from the period of March 1st through the end of July. So we expect that first reporting period, we expect that it's going to be a big one for you guys. I mean, there's going to be maybe quite a bit of money that is allocated to you or reimbursed to you after that. So because it covers that 5-month period. But beyond that particular reporting date, we don't expect, that volume. Obviously, it's just going to be for the previous month. So each month on the 10th of the month, your reporting is due to us. We have to actually turn around and report all this to OSBM within pretty tight timelines after that. So it's really, really important that if we have questions about anything that you've submitted, that you are following up with us promptly about it. We need you to respond within 3 days to any questions that we have about the documentation that you've submitted. We want to make sure you get reimbursed. And so in order to meet those timelines, that has to happen. So keep that in mind. And I'll give you a schedule of sort of the different time points in the grant life here at the end of the presentation, just so you can see that. We are actually submitting all of your reporting and even your grant agreements to OSBM on your behalf. We want to make sure that we're supporting you as much as possible with this, and so we're going to be doing that on your behalf. So just kind of keep that in mind. We do have those timelines that we have to meet. When it comes to the reporting periods, try to make sure that you're not going back into another reporting period. So we need to get all expenses accounted for within the reporting period that is occurring at that time. So there's no going back to previous reporting periods. So try to get all your expenses covered, with that particular report. And then if you find, excuse me, if you find that at some point during the grant you exhaust your allocation, please keep reporting. Because it may be that we have to shift some funds around to help clinics that have more expenses, and maybe to help those clinics that perhaps have less expenses. And so please keep on reporting, because that's going to help. And certainly if we get any changes in the grant structure or anything like that, then that'll allow us to do that more efficiently. So each month, on the 10th of the month, you're reporting your attachment C1, which is the monthly project status report, as well as C2, which is the reimbursement request. And we're going to go through each of those. And again, for all expenses, we need, your payroll records, your benefits records, if applicable, those timekeeping records for the employees that are not credentialed clinical staff, and then certainly any invoices. All right, this is attachment C1. You'll notice in the instructions up at the top of the form that we ask you to report, and this is sort of the outcomes piece of things with the grant, but we're asking you to report some specific numbers. And those are the number of patients that you served during that time period, the number of new patients that you served during that time period, existing patients, kind of the breakdown between new and existing, and then the number of COVID-19 patients specifically that you've served. We also need, there's other information here that we need. I think the form is pretty self-explanatory, but certainly if you have any questions about that when the time comes, you can always reach out to me. I didn't mention earlier, when you submit your documents, you're going to get, and you opt into the grant, you're going to get a grant agreement number from me, and I will fill all that in for your initial submission of your documents. But in the future, when you submit your monthly reports, you're going to need to make sure to put that number in here. So you'll notice on this form, it says 32-00-1 under contract agreement number. Your number may look very similar to that, but we'll assign that to you when you opt in. This is attachment C2. This is where you're going to designate any of the expenses you've had in that reporting period. You're going to need to note, if you're using staff expenses, you're going to need to note the employee's name, their title. You're going to need to put the number of hours worked, the invoices amounts, the time that was dedicated to COVID-19. This is where you're going to document all that information. And then you're going to need to submit those backup documentation as well with it. All right, here's our timeline. So this is kind of the life of the grant. We are here in the second line with the informational webinars. This Friday represents the opt-in, opt-out deadline. When we talk about opting in, what that means is you submit your grant documents. So when we talk about submitting your grant documents, what that means is that you get me Your signed grant agreement, a PDF is fine. If you want to send that via PDF, that's probably easiest. We need attachment A1, which is your scope of work. The attachment A1 will not change, so don't edit that form. We've pre-filled that for you. You just need to fill in the top portion of it with your organization's name and the end of your fiscal year. We want the scope of work to be consistent across the entire membership, so that's why we're asking that you not change that. Attachment A2 budget, again, we have put everything in under staff expenses. If you're going to be allocating it to other areas, please do that on your attachment A2 before you submit to us so that we have a sense of what that's going to look like for you. Attachment D. Now, I've had a lot of conversations about attachment D. This is the no tax delinquency certification. I recognize with COVID-19 and with lots of folks working from home, it might be difficult to get that form to us by Friday. That is fine. If you need a little bit more time, we can accept those next week. I'm happy to do that in order to make things a little bit easier on you and not have to get people together that might be at risk. And it's because it's a notarized form, it might be more challenging to get that notary signature. We have had a couple folks ask about recommendations for ensuring that that can get in. And we've had a lot of creativity too in terms of how this has been done. So some people have done a Zoom notary session, which has been interesting, and that works. And so, in other situations, we've had one person sign it and get it notarized and forward the original document to the next person who signs it and gets that separately notarized, and that's acceptable too. So we're willing to work with you on that and give you a little bit more time if you need that for that particular form, but try to get everything else in by the deadline this Friday. And then attachment E is also needed to opt in. That's the one that contains your DUNS number. The DUNS can be requested online. It takes a few days to get that, so try to work on that as soon as possible if you've not already. And then your conflict of interest policy, which we've had a couple other questions about that as well. We provided a template for the conflict of interest policy, and you're welcome to use that and adopt that for this grant and for your organization. It actually was created specifically to address requirements of state grants. So feel free to adopt that. However, if you already have one that is sufficient, then you can submit that. You don't have to necessarily adopt the one that we provided. And then if you choose to opt out, just provide an email to me with your reasoning for opting out, and that way we can show due diligence in offering that funding to you. So you'll see we've got our grant reporting timelines here that are on the 10th of each month. At some point later in the fall, we may have to do a redistribution of funding between clinics if we see that we've got clinics that are maybe not utilizing their funding fully, and that's okay. If that happens, but just know that that's probably going to occur sometime in October. And then all of your final reporting, which is attachment F. All right, can everybody please make sure that you're on mute? We've got a lot of feedback actually on the line here that's difficult to hear. So the final reporting is due on January 10th. And we've had a couple requests on contracts to extend that. And we're not able to extend that, unfortunately, because we have turnaround timelines that we have to meet with the state. So the 10th is the absolute deadline for being able to turn those final outcomes around. So I know that's a tight timeline, but we don't really have a choice in that. We have to get information to the state very soon after that. Okay. Here is my contact information. You are more than welcome to contact me at any point if you have any questions, additional questions. I did want to address a few things that had come in via email that maybe probably were not addressed in the presentation. So we've had questions come in about lab expenses and whether lab expenses could be covered under the grant. They could if they're COVID-19 related, but they have to be COVID-19 related. So lab expenses for other things would not necessarily be covered under this grant. So just a heads up there. And we also had a question about whether a separate bank account was needed in order to manage this funding. It is not required to have that. You just need your accounting software needs to be able to designate this funding separately. So as long as that you can manage that funding, this funding separately from your other stuff, then that is fine. You don't need a separate bank account. All right, so having said that, we've got about 15 minutes left. I'm gonna turn it over to Mark, who has been monitoring the chat, and see if we have any questions come in that have not yet been addressed. And I will do my best to answer them if I can. If I cannot, we will make sure to get them addressed and put them in the frequently asked questions.
All right, Allison, the first question is, do payroll ledgers need to identify staffing, positions, and titles? Basically, what do the timekeeping records need to include?
That is a good question. So you'll notice the reporting that the attachment C2 does ask for that information. It asks for titles. Mark, you mentioned titles, and what was the other thing?
Titles, staffing positions, and titles.
Yep, and so the C2 reporting format asks for both of those things. And so, you know, as long as we can tell that it's the same person, right? So as long as we can tell on the payroll records that it's the same person, and you've documented their title and their position on attachment C2, I think we're good.
So if you're using an electronic payment service, your payroll, how should the other time records be kept?
Yep, so time records need to be kept. So that's a good question. So if this is a person who is a staff member who is not a credentialed clinical person, then we will need both the documentation of the payroll through the electronic payment service of what they were paid. And then we also need their timekeeping records to show, so their time card essentially that would show the percentage of time or the number of hours that were dedicated for that person, dedicated to COVID-19. So if you have that electronic payment service, we just need, you know, whether it's a PDF or some kind of summary of what the payment was to that particular person. And then we need their time cards. We don't need time cards for folks that are the credential staff. We don't need that because they're already considered substantially dedicated.
For previous months, can they go back and add the necessary documentation to the timesheets?
Oh, that's a good question. You know what? Let me get back to you on that. We're gonna discuss that, and let me get back to you on the appropriate way to document that. Yeah, that's a great question. We'll follow back up on that one.
And then if your pay periods don't coincide with the reporting dates, should they be proportionally allocated? How should that be handled?
Yeah, that can be prorated, I would think, if it doesn't coincide, or you could even wait till the next, you know, reporting period if you wanted to.
All right, I'm getting a lot of questions coming in, so give me just a second.
Okay.
If you have a clinical staff member that is administrative but has had to start seeing patients, is this allowed?
You have an administrative person that has started seeing patients.
Other way, if a clinical staff member that is administrative but has had to start seeing patients.
So I think we have to go back to that definition of substantially dedicated. So are they 50% or more on those clinical responsibilities? If so, they're considered substantially dedicated. And if not, then we need to look at the amount of time that was spent on those clinical responsibilities. And that's assuming that person falls under one of those categories for credentialed clinical staff. So if it's a 20% of their time focused on those clinical responsibilities, then yes, that could be applied to the grant.
All right, next question is, will we be allowed to later revise our initial budget?
I'm assuming this is maybe an organization that has already submitted their budget. And if that is the case, then yes, let's talk about that. If you've not submitted it yet, then yes, you can absolutely, shift around some of those funds. Again, just with the understanding that, we're really recommending as much as possible to focus on those staff expenses.
How about administrative personnel who have time records supporting COVID-19 related expenses at 50% or more? Are they then considered substantially dedicated at 100%?
So if we go back to what we talked about with administrative staff, they're presumed to not be substantially dedicated. Substantially dedicated is defined by 50% or more. But if they are 50% or more on COVID-19 related activities, then yes, they would be considered, that would be 100% on the grant.
Is there a template you would provide for the final report and for the final report and accomplishments requirement that's due January 10th?
That's actually attachment F. So if you look at attachment F, you'll notice that's the final reporting. If you have funding, if you have reimbursements at that time that still need to be accomplished, then you would also submit attachment C with that so that you could get that final reimbursement.
Okay. Every patient we see is affected by COVID-19. The way we have to see them, the PPE we need to use, telemedicine we use, etc., regardless whether the diagnosis is ruled out COVID-19. We are forced to use lab tests to treat our patients when we can't see them face to face, so those lab tests are COVID-19 related. There seems to be an arbitrary sense that only if we are testing for COVID is it COVID related. All of what we do is affected by COVID.
Sure, and that's exactly why that staffing expense is, for those clinical credentialed folks, is considered substantially dedicated. This is actually related to a question that has come in at another time, and that is, in fact, let me read this question out because it is sort of related. Can the funds be used for patient care not related to COVID-19 specifically? For example, the patient visits via telemedicine to obtain or to maintain chronic conditions for which a patient was already being seen, maybe something that puts them at risk for COVID-19. So the deal with this is that if we're allocating money to staff expenses, you can't also allocate it to those visit expenses because then it would be considered double dipping. So that's where we have to be really careful about that double dipping, definition.
All right, can you discuss the two questions on attachment E? This requirement has not applied to clinics that have not previously received federal money.
Yep, and that's the DUNS. Let me pull that up right here real quick. Those two questions are, okay. In your business or organization's preceding completed fiscal year, did your business organization receive either 80% or more of your annual gross revenues in U.S. federal contracts, subcontracts, loans, grants, subgrants, and or cooperative agreements, and two, 25 million or more in annual gross revenues from U.S. federal contracts, subcontracts, loans, grants, subgrants, and or cooperative agreements. So you'll just need to answer that on behalf of your clinic. I don't have the information to be able to answer that on your behalf, but you would need to answer that question. And then, does the public have access to information about the compensation of executives in the business of your organization? The legal entity to which the specific record represented by the DUNS number belongs through periodic reports filed under, and there's a whole section of the Internal Revenue Code. That would need to be answered on behalf of your organization too. We would expect that would be available, publicly available through the annual reporting that you do, but that again, that's something that your clinic would need to respond on your behalf for.
What is considered COVID related?
Yes, that's a good question. So COVID, unfortunately, we don't have a specific definition for COVID related. And so that is really something that your clinic needs to look at. And I mean, it needs to, for instance, if you have, the example that we gave earlier with the medical receptionist who's doing the COVID screening questions, that's COVID related. You have to be able to demonstrate that in some way or another. So if you can demonstrate that it is COVID related, then we're good. And if you can show on your time records that this particular person, contributed so many hours to the COVID related activities, then we're good. Defining that is challenging, and I don't have a specific definition, unfortunately, of what that is. But we need, again, to just kind of think about the responsibilities that your clinic has in dealing with COVID. You guys know that better than anybody does. So if you have specific questions about what might be considered COVID related, we can definitely discuss those.
I guess this is a specific question. What about spending time to educate COVID-19 patients on how to protect themselves?
That is COVID-19 related.
If our DUNS number is not available by Friday, should we submit documents to opt out? I mean, excuse me. Should we submit documents to opt in without the
Yes,
DUNS number?
please do. We can give you a little bit of extra time if you need to. We want you to opt in if you can. And the DUNS number, we can wait a few days on that. So absolutely, I'm more than happy to make exceptions there.
And then the list of forms needed to be sent by Friday, I think that's probably.
Yeah, I think we covered that. If you have specific questions though, do let me know.
Okay, all of our patients are COVID-19 affected either by loss of employment and insurance or high-risk chronic disease patients.
Mm-hmm.
Will these patients be considered COVID-19 affected?
Yes, and that's why there is that substantially dedicated classification for your credentialed clinical workers.
The stats ask for patients seen. What about patient visits?
We're looking for unique patients. So a unique patient count on that, in that regard. We're not looking for the number of visits.
All right. I'm just reading through these real quickly. COVID services include screening without testing as well as with testing.
The COVID screening, did I hear that right?
Yes.
Yes, that is correct.
Okay, this is a follow-up to a previous question. If we are not double dipping and we are seeing patients with chronic illness by having to use all the precautions and creativity we must use in this time of COVID, all of what we do is COVID related. All of what we do has been affected by the COVID pandemic, changing the way we have to do what we do.
Yes. It is. And what is the question with that?
Well, I guess he's just confirming that what they do is, he's saying everything they do is COVID related. So.
Yeah, everything. Yeah. And again, that's why that designation of substantially dedicated exists. And that's why we, our credentialed clinic staff have been designated as public health workers under the COVID-19 emergency. And so, that's why their payroll is covered 100%. Again, when we look at the breakdown between clinical and non-clinical staff, OSBM does have stipulations related to that. So they don't assume that all administrative staff are, engaged in COVID-19 work. They're presumed to be not substantially dedicated. It's our job as in order to be able to show that they are engaged in some level or another with COVID-19 work.
Allison, this is Randy Jordan. We, in the early negotiations, made that very argument to the Office of State Budget and Management that everything that happens in our clinic is affected by COVID-19. And while that argument holds sway, it didn't carry the day in that there was still an obligation with regard to non-clinical staff to demonstrate through a payroll record or through a timekeeping mechanism the magnitude of dedication to COVID-19. So as you stated so well, we're not dictating what that determination is at the local level, but it would then If that's the position of the clinic leader, then they would need to record their timesheets with that COVID-19 relationship designated so that they would then have the audit trail to support the position taken.
Absolutely. Thank you, Randy, for that. Great point.
All right, this question might need to be clarified. Can we expense our medical director's monthly payments since he volunteers as a credentialed staff member during the clinic as well?
I tell you what, why don't we plan to follow up on that individual situation and we can talk a little bit more about that. Mark, if you could note who that question was from and why don't we follow up on that one individually?
All right. CVault03, can you just do a private message to me and let me know? I'm trying to figure out who you are, but actually I think I know, but go ahead and reply back to me privately, please.
And that would be something that, you know, if it applies to other clinics, we'll put that in the frequently asked questions so that everyone can have access to the answer to that. In the essence of, or in appreciation of everyone's time and to be sensitive to everybody's time, we are at the top of the hour. Mark, about how many questions do you see remaining in the chat, just out of curiosity?
Oh boy, you're gonna be here a while.
Okay.
A
I
lot.
thought that might be the case. And so what we have the opportunity to save all of the information in the chat. And so I just want to, if your question did not get answered today, I just want to assure you that it will get answered. And we're going to try to do that as soon as possible. If it's a situation that's probably unique to a clinic, we'll probably reach out to you individually about that. But if not, we're going to try to get all those answers into the frequently asked questions. Again, we want to just be really sensitive to everybody's time. We know that you guys have a lot of important things that you're working on right now. So we don't want to keep you longer than we promised. So more than anything, I just want to thank you for the time that you've spent today with us. And I want to thank you for all the great questions and your engagement in this. We hope that everybody has the opportunity to opt in if it's a good fit for you guys. And if there's anything that I can do to support you or any questions that I can answer, and if I can't answer, we'll definitely take it to our team. And if the team can't answer it, we're going to take it to the state. So we will do that on your behalf. And we're happy to do that on your behalf so you can get some additional clarification on some of these important questions. So we are going to go ahead and wrap up for today. And Mark is going to save the chat and we will follow up with everybody through that frequently asked questions document. And again, you're more than welcome to reach out to me if need be. So hope everyone has a wonderful day. Thanks again for your time and we'll see you soon.
Thank you.
You're welcome.
Thank you.
Take care.
Thanks, guys.
Welcome. Thank you.
Alice, you want to stay on for a couple minutes?
Sure.
We can talk.
Yeah. I tell you what, Mark, why don't we, so that we have the recording that ends so that everybody can access the recording and we don't have to edit too much, we might want to go ahead and jump off and then jump back on. How does that sound?
That sounds good. Give me a couple minutes.
Okay, no problem at all.